please do share your comments. I saw you nodding your head on Kishor's comment about creating more Wikipedia pages with evidence. And,
I don't want to waste anybody's time anymore. I just want to express my appreciation for all of your points and comments, and I'm very honored to be here. And I also have to convey greetings from Professor Piracs from University of Latvia. That's all. Thank you.
Thank you, Cynthia. If I may, Baswati, if I may,
go ahead.
If I may, I just want to hog the screen for a few minutes.
Yes.
Keep it to less than 1 minute, just to do a bit of advertising here. And this is partly in response to Vaidya Prashad's comment that we need a home where we can bring these multiple disciplines together. This is one congress that is scheduled for February next year in London. And they are saying we want to bring these multiple disciplines together, but this would be at a different level. And I think the Baswati's comment is correct. The whole spirit of the Ayush Valley is to take the strengths available in India and to bring it to a home where we can discuss these issues. And we feel it should be done under the purview of an established institution like the Kerala Ayurveda Samajam. So we want, hence the reason for coming as close as possible to the Samajam, which has a very old tradition and a very important lineage that we have. There's another event that is coming up in Prague later next year, in June next year, 11th to 13th of June, and it's called the World Health Congress. The website is up here on the top, whc2020prague.com. These kind of questions and discussions, we want to take it both to London and to Prague. I don't know if everybody there will appreciate the fine details that we are talking about, but I think there will be minds who will understand what Prasadji, what Srivatsji is presenting here, and the kind of things that Kishor is offering us, and the kind of things that Leah and Cynthia are offering us. Finally, discussions of this kind are central to where the moods are today, the connection between environment and health. And this is all appreciated well in the Ayurvedic and the Vedic systems, that the roots of human health are growing in the healthy soils of diverse ecosystems. And these are things that are being discussed. People, when I look at the discussions, they're grappling with these ideas. I wish they can all be brought to the world of Vedic sciences and Ayurveda and the Indian systems, so that they understand how logically this is all presented in terms of planetary health and how we understand it already. And maybe we are practicing it, maybe not correctly, but this is all understood by all of us. Now, I finish off with this little note here, which is that there is a concept of health which is different from the concept of health care. And I think that concept of health, swasthya, as in Ayurveda and the Vedic sciences, is so well understood in our systems. And somehow this message is not going out. We seem to get caught somewhere in Ayurvedic formulations and, small modalities, and not the bigger picture. And I feel what Prasadji has offered us, and asking for a home. And the Ayush Valley wants to be that home, and we will try to do everything to provide that home and to enable these kind of discussions, to bring out rich concepts like health. What do we mean by health? And how is health understood in terms of the Ayush prism? And finally, this whole thing about when we go into deep principles like prana, and we go into deep principles about Jataragni and the contributions of the Shahajakrimi, or the way it's understood in Ayurveda, and how it is being used routinely for treatment and for managing health conditions. There is a comment here, which is that we are an extremely complex organism. And I don't think we will understand this in that reductionist approach. Srivatji used a very nice term, holistic reductionism. And I think this is what Ayurveda offers us, holistic reductionism, where we see that entire concept of health at many, many levels, whether it's planetary health or whether it's health of the universe, trickling all the way down to the health of the human being and to whatever is in every cell in our body. That holistic approach is understood in Ayurveda. The concepts are very clear. I think it's for all of us to be articulating this more and more and drawing more people into this kind of thinking, especially young students, whether they are in modern medicine or in Ayurvedic systems, to bring them all together to where we should be going and where we need to go. I don't know if my screen was sharing there, but
no, it wasn't.
It wasn't. So, Baswati, I think I was reading out from my screen. Sorry, I couldn't share my screen here. But if I'll quickly do this before I give the floor back to you.
Just show us your screen for a moment so we know what
very quickly, so that you can get an idea of what I was going on about. I don't know how I missed sharing the screen. So this is number one.
Because you have too many windows open.
Too many windows open and too many doors closed. Okay, so here it is. Is my screen visible? This is event number one, the European Congress for Integrative Medicine. Their perspective on integration of systems of medicine is very different from what we've been talking about, but I think there is a room for a dialogue. And this happens in late February in London, and that's the website, ecimcongress.com. The second event, which is happening in Prague, that's the website, World Health WHC 2020 Prague.com, and that's scheduled for June next year. Please do visit the site. You will see the way the ideas are evolving here, and what Prashadji, Srivatji, Kishor, and Leah, and Cynthia have offered today. We would like to take this discussion into a more crystallized form into places like this. This was the other thing I talked about, our planet, our health. These are discussions going on in terms of the United Nations Sustainable Development Goals. We understand as well the importance of healthy soils and ecosystems and human health, how to bring it out to a wider audience. These are all things that everybody talks about. Sustainable Development Goals is central to every discussion on health these days. This is very well understood in our systems. Concept of planetary health is also starting to make impact. This is the concept of using that Ayush way of looking at health. On the right-hand side is that spectrum we have generated by reductionist thinking. We have all the colors and hues here. You know, somebody's looking at mitochondria, somebody's looking at a certain subset of blood cells, etc. So we've got all those details. We need to see how to bring it back together to make sense and to understand the way that Srivatji mentioned about reductionism, holistic reductionism, and the logic that is used. And finally, this comment that we are such a complex organism. We can throw as much resources as we want, but if we don't understand how to approach this problem correctly, we will not arrive at anything meaningful. So I feel we have touched on many of these points here today, and we will come back to this again. I hope when we write this up into a small discussion document, all of these ideas will be captured there, and we will take it on towards the next levels of discussion. So thank you, Baswati.
Thank you for your comments. Thanks to Dr. Sintija. We wish you the best for your PhD thesis and for your work and for safely traveling. I know we who travel between continents and live between continents are having quite a challenge right now with COVID. So I wish you well. To Leah, thank you so much for getting up at 4 in the morning. I know that it is very early in Los Angeles and that you have patients today. So your perspectives on yoga therapy and on Ayurveda were very useful. To Dr. Kishor Patwardhan, Professor, thank you so much for contributing your knowledge of Ayurvedic education and where it is, and really saying very solidly what your research among students has shown, that there are things that are the elephants in the room that no one is talking about when they are putting together the national education policy or the Ayurvedic discussions with the ICMR and all the other schemes that they're coming up with. They are ignoring some very basic facts, which is what our audience, if you saw in the comments, are talking about. They want real education, and you have brought up many of the points that need to be addressed and not ignored, because it's the reality of the situation, and research must start with the reality. Thank you again to Dr. Vaidya M. Prasadji for your comments, to Professor Srivats for your comments, especially about Marma, and to Dr. Kapadia, who also talked to us about mental health. Thanks to all of the discussants who put comments into the chat, into the questions, and who spoke and had dialogues as we were speaking verbally. I also want to thank...
I see one raised hand. There's Pallavi Sodhi Patanka.
Yes.
I think if you wanted to bring Pallavi in.
Dr. Pallavi, if you, yes, let's have you come in. Hi, Pammi. Come.
Mute, yeah. Am I audible?
You are.
Am I audible?
Namaskar.
Namaste, good evening and good morning. And Dr. Madan Bhaspati, it has been excellent. My great applause to Cynthia and Leah and Dr. Kishore. It has been an excellent deliberation and discussion. I really feel sad that we have graduated in such a poor infrastructure. We don't know how to do research. We feel so handicapped. And I hope what Dr. Kishore said, that there has to be 2 years of basic foundation, and then the students decide which stream they want to adopt. That is what I had suggested to Dr. Hegde in one of the international meetings. Dr. Girish Tillu from Pune had organized a very nice meeting, and there I met Yannick. Dr. Madan knows Yannick from Belgium, and he is also in a great effort to form a single university which brings down all the multi-dimensional therapies under one roof, under one heading. So there is a dire need that we need to work upon to bring Ayurveda and project it in the right way. Cynthia mentioned about communications, which is really, really the need of the hour from our Ayurvedic group of doctors. So excellent. I'm very happy and fortunate to be with you all. Best wishes and good luck. Stay safe, stay healthy. Thank you.
Thank you, Pallavi. Pallavi brought up an interesting point, which we didn't mention today, and that is that one of the things that goes on with the students is that they don't have that level of confidence. It is something that I encountered with the BAMS students when I was doing my PhD. They don't have confidence to actually stand up and say, this is what we want. We are the end users. We are the people that are graduating. And it is actually one of the reasons why Ayurveda has not had those people coming forward and promoting new research methodologies or new educational techniques. Because I see the systematic depression of people who don't have confidence. So I'm living in a hospital here as I'm doing my postdoc. And one of the young doctors was saying that he went to an allopathic operation, a surgical operation, where the allopath actually pointed him out and said, oh, you are that BAMS graduate, right? And he said, yes. He goes, do you even know that there's a structure called the gallbladder? There's a liver and there's a gallbladder and there's a little duct in between. Do you know about this? And you know what we do? He was very, very condescending. And this doctor was quiet because in Ayurvedic education, we learn to stay quiet. We should never, ever disagree or stand up for ourselves. And he was quiet, and the doctor said, see, you Ayurvedic people don't know anything. You don't learn anything. And he said, well, actually, sir, We've learned the gallbladder, we've learned the liver, and we've actually learned about these surgeries. And I know exactly what a laparoscopic cholecystectomy is. I'm here to observe it from you, sir. And he was very polite, but he took a lot of humiliation and a lot of condescension from that MBBS surgeon who just systematically put it across that Ayurvedic graduates don't know anything. Madan and I also had a conference call with an ophthalmologist recently who talked about the people that he had worked with from the Ayurvedic world, students who had come to learn. And he said that he was so disappointed in how they stand up for themselves and their level of confidence. So in our brainstorming, two of the things that we were talking about, Dr. Madan and I, is that it would be wonderful if every school would take on a presentation seminar, how to present, how to have the confidence to present, and to train that to BAMS students before they graduate, because all BAMS students, if they go out into practice, have to speak to their patients, if not give seminars. Another is to have an English master's graduate who is a medical writer to help people learn how to write articles. As a reviewer, I see so many articles that would be excellent to have published for the knowledge, and yet the English is so terrible that they cannot get their ideas across. These are some of the things that we need to give to Ayurvedic graduates, and they need to be inserted into the Ayurvedic discussion on how to reform education. So if any of you have access to the CCIM governance or succession committee, these are the kinds of things we'd like to put into the white report, the white paper, and we welcome each of you to contact Dr. Madan and send us your ideas, send us your feedback, send us your information, your prototypes that you think have worked in other fields or in other places that you would like to try out in Ayurveda, and we will help get you connected. We will have another series of seminars. We welcome you to participate in those as well. Madan, do you want to tell about the next seminar?
More than, thank you, Baswati, thank you. I've just put my email, the Ayush Valley email here. Please do connect. I'm just scanning through the list of participants here, and I have Dr. Arshad. If you can get Dr. Arshad to just say a few words. Dr. Arshad is very important for us.
Dr. Arshad, please.
Dr. Arshad, can you see Dr. Arshad?
Yes, I've already enabled him.
Yes, there we are. Dr. Arshad, namaskaram. Hello.
Could you unmute yourself, sir?
Dr.
Okay.
Arshad?
I've unmuted.
Sir.
Yes.
Namaskaram. Welcome.
Yes, sir.
Thank you. Thank you for staying with us so long.
Good evening.
Good evening. We just wanted
You
a few words.
and
We just want a few words from you.
participants.
Please go ahead.
It was a wonderful session. When we are studying at the BAMS level itself, we have this kind of thoughts in our minds that Ayurveda Academy should be changed contemporary, and all has to be evidence-based. And we have made such a movement at that time itself, 25 years back. And ultimately we are in vain. Nothing happened, and we met many authorities, even the academic council, university. I studied in Kottakkal, and later I wished to change myself. I did postgraduate diploma in sports medicine from Apollo Hospital. So I made a different way, and I started an integrated sports medicine center in Kerala. It was the first center in 2001 we have started in Kerala, Integrated Ayurvedic Sports Medicine Center, and it was wonderfully doing, and we have treated many international athletes and sports persons, and we have scientifically proved with all the evidence-based protocols like meniscal injury and rotator cuff, Bengal lesions, and so many shoulder injuries of shoulder and soft tissues injuries, and this was the main base of Ayurvedic sports medicine even to develop all over India. And unfortunately, I could be one of the part of the doctor to work with the Sports Authority of India in the first time in the history of the Indian sports. It was in 2009. I worked with the Sports Authority of India, and it is we changed our direction into a new dimensions. So this kind of thing has to be developed. New inventions, new ideas, new developments, new technologies has to be implemented in Ayurveda to develop the science and to develop the whole the community, and we can help the society by providing better treatment. Like if you are going for a surgery for shoulder, it will take around 6 months to 1 year to back to the sports. By means of integrated Ayurvedic treatment, we can avoid the surgery and we can back to the sports within 3 to 4 months. So it is an advanced integrated treatment, and we made it in a quick action Ayurveda. Usually people comes to Ayurveda because its action is slow, but we have mentioned it is quick action Ayurveda.
Thank you.
So thank you to us. This is a message. I personally know Dr.MadanThangavelu sir in several meetings like Global Ayurveda Fest and World Ayurveda Congress. We have met many times, but I don't know whether doctor is remembering me.
I do. Dr. Arshad, we are so happy to have you here with us. And your work is very special. Your work with all our top athletes, Johanan, the long jumper, and so many other people you have treated, and we follow you closely. So we are grateful that you are here with us. We are very grateful that you stayed till this very end.
And we want him to publish some case reports.
Yes.
What we really need you to do is get some students who would like to work with either astidhatu or with a particular compound that you use like Gandhatailam or Lakshadi Gugulu, and to actually publish case reports. And we can actually show you how to do that. My hospital is gearing up to do a series of case reports and write them in a gold standard method. Once we get those out there, I hope that more people will use their own cases to publish them. But we need you to do that because we know that orthopedic histories can be healed superiorly using Ayurveda, and we thank you for your work.
Arshadji's comments, I still remember where he says that people should come to me only if they are willing to work 18 hours a day, otherwise don't waste my time. So I like that spirit very much.
He was just going to say something. Arshadji, you wanted to say something?
So being in an individual institution, I have so many limitations. So for research and some kind of methodologies and some developing some scientific realization, we have to work together with an organization level or something like research institutions like tie-up. We have been, I talked with the All India Institute of Ayurveda, and again myself and Dr. Kraemer sir was also with me. And we worked many occasions. Everything is going on the way. We will expect in the future.
I also, Bhaswatiji, if I may just quickly bring in Dr. Srivats, because he is instrumental in developing, if I'm not clearly, Dr. Arshad has a history there, but Srivatsji managed to get the Kerala government to invest in developing Ayurvedic sports center in Thrissur. Srivatsji,
yes, tell us about this.
Please tell us how you made this happen, because if I remember our conversation correctly, you said this was one of your, the achievement you're most proud about. So Arshadji's work in Kerala and what you have enabled, please do comment a little bit so that we have recorded it and people who are coming to this site will be able to hear about these things.
Thank you, Madanji. Actually, it's I should not own up on that because I should thank the government of Kerala, the Indian Systems of Medicines Department, to have, and the people who were in 2009, who were, of course, we were all juniors at that time, but the officials at that time, they had planned it. The only thing is that we always had been a team, it was a teamwork called the Sports Ayurveda Research Cell in Kerala under the Department of Indian System of Medicine. And when I joined back after this government service, after the academics or academic administration, I was in charge of as the state coordinator, and I tried to give some direction to the development. And in turn, fortunately, it was at that time everything materialized. So I would like to state honestly that I was only a part of the whole team who was doing the job, who were doing the job. And Shad, I'm very glad because he is a very enthusiastic. He was, when I was leaving Kottakkal, he was joining Kottakkal. And during my internship, he was in the first year. So we always, in sports Ayurveda, the name coined itself is a new opening as far as Marma Chikitsa was also concerned. And we used to tell that now what is catchy should be the best method of popularizing also. If I talk about Marma Chikitsa, less people understand. But if I talk about sports Ayurveda or Ayurveda in sports medicine, then people know it very easily. That's what I told about the torch. So then the entry is very easy. Now, we had been proving in Kerala in the last 10 years, these very specific cases, very good expert people like Dr. Arshad, Dr. Matthews Wembley, Dr. Jain, Dr. Suresh Kumar C, who was in Triveni Nursing Home, Trivandrum, and many people who are our colleagues, and the whole junior team now, they are working very well, and so many wonders have been happened, like Dr. Arshad told. And if proper documentation and proper promotion is given, one thing I'm happy to tell, as Dr. Arshad told, All India Institute of Ayurveda has already developed with Skills India a course for sports Ayurveda therapist. And now I hear from Dr. Hemant from National Institute of Ayurveda that a 2-year MSc program is being designed for Krida Ayurveda or sports medicine. And I'm glad to tell that myself and Dr. Arshad are invited in the external expert group for planning that. So at the national level, as he told, if things are coming up, and if as the new graduates in Ayurveda find that, okay, there is another scope of getting a mileage of what they have studied, or to put into practice what they have studied, and that too in a glamorous field of sports medicine, then surely that is a good opening. So it has come up now. I tell that because that thing has been opened up, as Madanji told, it's a passionate thing for us. Now sports Ayurveda nutrition, sports Ayurveda, even see, according to the Prakriti, selecting the candidate who can be recruited for the particular sports. Whether it is endurance based, whether it is strength, whether it is speed based. See, Ayurveda has a input into it. The anthropometry has an input into it. And the whole injury management on the field, off the field, if you have the Marma knowledge and Abhighata Chikitsa knowledge or the Bhagna Chikitsa knowledge, then you are far ahead in handling the situation, which we see it practically. Maybe in the modern medicine in India, the sports medicine has not been developed that much as in other Western countries or European countries. That may be one of the reasons. Whenever we go to a competition as medical assistants, we see that there is nobody from the modern field, as far as Kerala is concerned, on the field to help the poor boys and girls who are running in very inefficient, tracks and other things in Kerala. But we have shown that, and the public are also appreciated it, and so that's a very nice opening. And there, too much, it goes into the interdisciplinary study of Ayurveda and even martial arts, as mentioned earlier.
Right. I was going to say that in Kalari Payathu, they do this analysis of.
Already the integration has been happened.
Yes.
There's
already a model for it thousands of years ago in Kerala.
Yeah, in Kerala Ayurveda. But now, once it is going into now, how to prepare we have evolved so much now in preparation, massage for preparing to avoid the injuries. Say injury, if it is happening, his future is at stake, as Arshad told. But how to prevent that injury and how to rehabilitate him fast. This is a very strong area. Ayurvedic nutrition sports nutrition is a strong area. I can go around telling about that because that's a passionate subject.
And I hope that you will go to the Natya Shasta, the dancers, because the dancers are people who also know very deeply how to keep their bodies strong, how to become stronger. In fact, Leah just left, but she used to dance for one of the leading, Joplin was this theater group, and she was a professional dancer for years. Her bachelor's degree is in dance, and she understands how to build strength. So she uses her dance training into yoga, and I have taught her how to use the herbs of Ayurveda to strengthen the bones and the ligaments and the tendons, and to understand that better. There's yes.
Like as you told, now integrating in many times yoga is looked down. Say in the sports field, they tell with very, very superficial understanding, they tell that, okay, if you take into yoga, the coaches and all tell to the their wards that if you take to yoga, you will become submissive, you will be very complacent, you will not be able to compete, etc. But what we have seen is that when they are put into yoga and meditation, they know this self. They are made to be aware of this swasthya, avastha, and they know the capabilities. They know their SWOT, and they do their SWOT analysis. We guide them to be trained in that. That is holistic approach of Ayurveda, not just giving kashayams and Thailands for that.
And you can tell them that they'll be able to see behind themselves, that they'll grow eyes behind them when they do proper yoga, because they will sense the other players on the field. They'll sense the ball when it's coming towards them.
Many times we feel
people don't exercise.
Yeah, many times we feel that we have to become the Krishna when Arjuna is depressed.
Well, I think what's happened is that there's miscommunication. We allow people to have the wrong narrative about yoga because we don't teach them. And people in India, because they are in narrow streams, think that most people are in narrow streams. What they don't realize is that the polymaths, the people that can do many things, are very much in Kerala and in Bengal. For us to have less than 3 proficiencies is bizarre. So for a person to understand sports very, very well and do yoga and know how to cook and know how to do making of herbs is all part and parcel of the work that you and Dr. Arshad are doing in sports medicine. And it actually comes together. But I would urge you to make sure you include some of the dance teachers who very, very beautifully train the women to be very strong, so that maybe they aren't playing competitive sports out on a field, but they're very strong dancers, and they have this knowledge within them, and they know how to integrate it.
You know that the Kathakali artists are trained, given massage for the flexibility of their body and to be enduring the whole night show, which they handle single-handedly.
And the big costumes that they have.
Yeah, the different postures. And now if Madam Leah and all are interested, they have to study the vadivas, different types of vadivas in Kalari, with different types of animal shapes they take with the body, like Mayurasana, like Kukkudasana, and these are called vadivas in Kalari. And that's a very, very wonderful this one. And these yoga postures, if you see that, if you are a runner and at the starting block, what yogasana is you are doing at that, or is similar to that, and which are the muscles which are integratedly functioning for that. All of these things are wonderful things. Which
I just offer you that if you would like to have,
I'll be going on, please.
No, just one comment. There is a book, if you are interested in giving some of this language in the language of allopathy to the doctors. The book is called Yoga Anatomy by Leslie Kaminoff. And what he has done is shown that there is an absolute biochemical and physiologic basis for the yoga postures that needs to be appreciated by the allopathic doctors. And the way that he set up the book is something that someone like you could flip through very quickly and use to validate to those people, to open up their mind until you can actually demonstrate to them in a practical and physical way. But that book offers a lot of wisdom for the allopathic approach. Madan, you were going to say something.
I was just going to just introduce Elizabeth Divakta. Elizabeth is here from Belgium, and Elizabeth studied Kalaripayattu in Kerala. If we put Elizabeth to just say hello to everybody. Elizabeth?
I just want to also say that those people who need to go, please do. We will have the recording available for you. And I think Elizabeth is now able to.
Elizabeth, hello.
I'm so happy to hear about the sports and Kalaripayat. I want to say that in the afternoon I take a class from Sanskrit. It's Serene Swan, it's a choreographer also from India. And together with her brother, they are promoting the arts and the Vedic chants. So choreography is to write choreo with movement. So grapher, it means riding. Choreo is the movement. So I'm a dancer. I like to more work with the sound of silence and the movement of Mother Nature. So I would like to inspire others to connect with the nature a lot. And as I studied the Kalaripayat, indeed, before I was
Elizabeth,
doing dance,
do tell us a little bit about where you studied Kalaripayat in Kerala.
I studied in close by Guruvayur in Trichur in Chavakat. And there I was, there is a thunder right now. There is the movement. Now it's thunder. Now it's thundering here so hard. So that's the movement of Mother Nature. And I learned when doing the Kalari, I took the massage. I cannot enter the Kalari and not taking the oil. And indeed, it strengthened my body so much, but I also cried a lot because it was so deep and so touching that no choreographer ever learned me about the sacredness of our body. So I'm honored by the sacred art of India, which is all of them, like it's singing, it's dancing, it's Kathakali, it's Kutiyattam, it's all those beautiful things.
Elizabeth also teaches young children in Kalaripayat in Belgium. So Elizabeth, we are very happy to have you here with us. Thank you for joining us.
Thank you.
You can see we have many friends here who can share so many things with you and grow all these activities in Belgium and in Netherlands.
Europe. And we are all daughters and sons of the sisters and daughters of the sun. So I think the wisdom is about the sunlight and the light, that we may proceed in the light and heal each other, proceeding in the future. And that's the work of the avatar. So that's avatar.
Arsha-ji and Srivatji might well know all the people in Chavakat, the place where you train. So thank you so much, Elizabeth, for joining us.
Thank you
and staying with us
for
to the very
doing.
end.
Thank you.
Madan, I think it's time to
I think we should
finish.
If there is somebody else on the floor among our participants who want to add a little bit, Gayatri.
Dr. Lavanya has been with us.
Yeah, Dr. Lavanya is there. So many people who are here with us. I don't know if somebody wanted to share.
Are there any medical students who would like to talk? Because today's theme has been on education, and certainly several of us are educators. We have been teaching actively, and we generally try to have some medical students who are the purveyors or the connoisseurs of the education that is out there. If there's anyone that is a medical student that would like to speak, Ayurvedic medical student, please raise your hand and we'll look for you. Okay, so it looks like everyone's ready to finish, Madan. I think we should end.
I'll leave it with you to, I want to, before I conclude my part and leave it to Baswati to finish, I want to thank a few people in particular. I want to thank Ayurveda Health Tourism, the magazine that's behind a lot of these things. So Benny Thomas, Benny is here with us. Benny might want to say a few words. I want to thank all of the group who've been helping us with all the preparations for the work here. Thank you so much. I want to thank people at the inspiration for us at Kerala Ayurveda Samajam for being here with us. And I want to thank Mr. Girishan of Top Spot Pharma. And Mr. Girishan could well be here with us. I don't know if Girishan ji wants to add a few words here while we are all here. But most of all, thank you everybody at the Ayush Valley for putting these events together. We have more events planned, and over the next few days, we will put programs up on the web and mail you about what is being planned. I see Gayatri Ji here. Gayatri, did you want to say?
Let's put Gayatri on.
Allowed to talk.
Gayatri, did you want to say something? Come.
Yes, I was trying to figure out how to get my mic activated.
You're activated. We can hear you.
Thank you.
Okay. Yeah. Unfortunately,
Gayatri is joining us from Heidelberg in Germany. Gayatri, welcome.
Thank you, Madan. Thank you, Bhaswati. I could only be very attentive towards the last half an hour, and otherwise I was still, doing something in the office, catching phone calls since most of the staff is on holiday. But I thank both of you a lot for this initiative, and the enthusiasm and the energy that everybody is showing is great. I think it's really very necessary, and to get a new impulse to what is happening with Ayurveda now globally. So thanks again, and yes, it has been a very long afternoon, so I won't take too much time.
Thank you, Gayatri.
Bye-bye.
Nice to hear from you after a long time. Let's finish.
Thank you so much for being with us. I've done my bit. Bhaswati, all yours now. You can.
You know, there is a place where Ayurvedic education is moving forward, and we didn't talk about it at all. And that is that people have been waiting for Ayush to move this Ayurvedic education forward. And indeed, it needs to be Ayush in India, because the ministry really governs all of the formal education that happens. But what I will welcome you to look at, for those of you who want to learn, is that frontier that is about people who just want to learn the information and are tired of waiting for Ayush to do it in a way that is responsive to the patients and the patient-centered medicine, and to the students who really want to learn, as Dr. Pallavi had said. So what they are doing is they're going to the international places where the students of other countries want to learn Ayurveda and are not be in BAMS programs or MD Ayurveda programs. So there are many online where you can learn Ayurveda from the core. And even if you have a BAMS, but you don't have a very good understanding of certain concepts, you can take these classes oftentimes for free. It's just your time that is needed for investment. And you can learn how to use Ayurveda practically. So for example, we have students who are learning the principles and learning how to treat diseases like Leah has been practicing, or the integration of whatever is healing for the patient by using a patient-centered approach. So as we were just finishing, I just got a message from a patient who's been with me for about 6 weeks. She has gadolinium poisoning from an MRI and has been unable to heal. Allopathic medicine is unable to heal her. She has neuropathy and neuropathic pain, vibrations, tingling. She cannot get out of bed for hours and hours, and she cannot stand for long periods of time. And she has been unable to heal. Using a systematic Kshetrikarana, I have been working with her, with one of my students, to bring her to a place where she could finally stand up. And today she just wrote to me, she's in America. She has stood up and made her own breakfast, and she has learned how to use Ayurvedic herbs that are Pittahara herbs. She's in phase 3 now, and she is now having full bowel movements and is able to feel her feet, feel her body, and her nerves are healing. How do we explain that to her? How do we talk to her? Do we say Majja Dhatu? Do we say nerve? What do we say to her? What she knows is that she's healing. It is cases like these that require us to work harder to bring good Ayurvedic education and good Ayurvedic research to the forefront, so that ultimately it's not just about us as physicians, it's about us as humans who are patients or patients of the future or people with families that need good quality Ayurveda. So thank you for, I'm just so happy about this patient. Thank you so much for participating with us. A big thanks to Dr. Madan, who, though he's a genome biologist, is also an avid studier of Sankhya and Vaisheshika and many of the Shaddarshan which are underlying Ayurveda. He is now a very sought after speaker in Ayurveda. And so you can go on YouTube and search his name and listen to some of his excellent lectures in which he asks a lot of the questions that we're asking today. How do we take it forward? How do we take this study and use it for Ayurvedic research? Or how do we take this study and translate it to the modern medical doctors or the biomedical scientists and use it for their research? How do we bridge that gap? So thanks to Dr. Madan and to all of you for participating. And we look forward to seeing you at our next session. Namaskar.
Namaste. Thank you, Kishore. Thank you, Cynthia. Thank you, Elizabeth. Namaskaram, Srivatsji. Thank you so much for sharing your inspiring comments. It's always a delight to talk with yourself. It is so wonderful to hear how you perceive aspects, complicated aspects like prana. I hope Benny Thomas and the team at the Valley will convince you to be with us in a slightly more deeper engagement, perhaps developing some courses to explain all this to people who want to learn but don't know where to go. So thank you so much for this.
To you all, Badram Badra Vilashanam.
You are always inspiring. And Arshadji, thank you so much for being with us today. And you inspire us in many ways about how perseverance and the dedication to Ayurveda can bring incredible results. And so happy to know that both of you, Srivatsji and yourself, are all students of Kottakkal, the college there. So this is an additional kind of attraction for all of us. Thank you so much. And I'm so happy there are still people with us who've come and asked interesting questions. Elizabeth, thank you so much for joining us from Belgium. I hope you will connect a little more with the sports medicine people, Arshadji and with Srivatsji, to see how we can bring something. Perhaps the Ayush Valley Foundation will catalyze, we can help catalyze this interaction. Sports Ayurveda is going to be an extremely important area, and I think what Arshadji and what Srivatsji are doing there, it needs taking out to the world even more. Bhaspatiji, thank you so much for holding us together here. And we will be, especially Arshadji, will be in touch. We continue to follow your work. We continue to see the amazing results you get. And I feel we need now to take this proactively to different parts of the world. People with sports injuries are everywhere. And I will follow on with Srivatsji to learn a little more about this course, the master's level course, the diploma courses that are offered by, together with All India Institute of Ayurveda. Perhaps
I want to be involved with that. Yes. I want to help to write cases for that.
Yes, yes. So,
I would love to work with Dr. Arshad and help you write some cases, because I have so many patients who I have helped heal their ligaments or their fractured bones. And as a family medicine doctor, I do all of it. I don't claim to be an orthopedist because I don't want to do the surgery part of it. But working with those and getting a really good case report done. It's people like you that have the cases, but you don't have a time or you don't have something that keeps you from actually publishing those case reports. And that's what I love to do. So that's what I'm doing here in this hospital. We're just about to publish one case on a diabetic carbuncle, one on Amavata, and one on a ACL joint that has been repaired. So,
Bhaswati, I have a suggestion here.
Yes, tell me.
If you want to, if we bring excellent minds like what we have here, Ashaji and Srivatji and Prasadji, and if you and Cynthia, and you bring one of your cases, see this gadolinium poisoning, and we can have one whole session just on this, where you could offer your case, because it's a very, very interesting problem that you have, that you're brave enough to engage with this case and what you're doing. And from people like Srivatji, Prasadji, we can learn a little more, and Arshaji, we can learn a little more about your approach to this and how they might approach this, and see if we can open up this space for more discussion, because there will be many people in the world who are suffering from this problem, you see. And maybe we...
Well, I would actually like to do it on diabetes, because that was my PhD thesis,
yes.
Synthesis PhD thesis, and anyone that's at ADP knows about the famous Indulal Vasudevan diabetes clinic that went on for some 10 years. I think Dr. Srivats knows about that clinic. And it was there when you were still there, when I was there. And to work with diabetes is such a great case study, and all of us would learn something. I don't have the thought that it should be, I can certainly start the presentation, but I don't have the thought that I know all of it. I just know that my patients in my PhD thesis got better. Many of them stopped having diabetes as it's defined as, high blood sugar. And so the question is why, the question is how, and the question is why doesn't allopathic medicine believe it when we treat things like this? Sports injuries are very easy, because once you've treated them, everyone knows that they're better because they do things that allopathic medicine thinks are impossible, like they walk on their legs again. That's very easy. But some of the chronic diseases are harder to work with, and this is what I do. The problem is that people don't want to hear from people like me, because I'm neither, as Cynthia just said so beautifully, we are not accepted by the medical community that are the mainstream people, because we do Ayurveda. We are not accepted by the Ayurveda people, and they don't accept us as speakers because we can't rattle out a bunch of shlokas. And we're stuck in the middle where we're only valuable to the patients and we're not valuable to the rest of the two communities. And it's a big, it's a big sad point, but it's a reality for many people who straddle between two worlds.
Well, let us see. Diabetes is a extremely important issue, and I think if Benny, Thomas, and the team feel this is good, we could have just this as 12 cases in diabetes as a part of a series, and how you manage the different conditions, the way you apply, where you have yoga-based interventions. Maybe we can also bring in some Siddha-based interventions here.
Yes.
And see if we can come together. Srivatji, I don't know if you would like to comment on this, or whether Cynthia wants to comment on this, or anybody wants to comment on this, because I put a note here saying Integrative Diabetes Case Studies on Zoom, sponsored by Ayush Valley Foundation. It'll be lovely if we do this. I will discuss this in our debrief meeting with all of us, with our team.
Do you think they're going to yell at you for having a 4-hour conference?
No, I think they're quite happy there, because we are pulling out a lot of initiatives that we would like to be to turn into mini projects for the Ayush Valley, and I think all these are high impact projects. Diabetes is a global problem, and if we can provide leadership in that space by saying this is how we understand diabetes in Ayurveda, and we can offer it to the whole world, saying this is, come to us. We have 12 cases on 12 days across 2 months. And this is what we have. This is what we do in diabetes. And I think if we broadcast it to the world, we might start to make an impact somewhere. I will follow this.
Sure, Madanji. In diabetes, there are many people, can be many good practitioners who are scholars who can be brought in. Where they've on gray areas of the modern management of diabetic complications, especially say if you go to Shalakya, Netra Chikitsa, we have friends who work on diabetic retinopathy.
Yes.
Now, what you call people, Chikitsakas who work on diabetic neuropathy. And so much of what you call
I feel, Srivatji, we'll come back to this and we will connect all of us together. Thank you so much for saying that we could come together on this.
So much can
be done. I think as we progress, I will come back, Srivatji, I'll come back to you on this point, and also to all of us here, Cynthia, special interest, and also Arshadji. We will come back on this. So I think Yadu might be wanting to leave now. Thank you so much to all for being with us. And